Last week, Dr. Michael Ryan, he's a leader at the World Health Organization, announced that in response to the spread of this virus, authorities may have to enter people's homes and remove family members, presumably by force.
In most parts of the world, due to lockdown, most of the transmission that's actually happening in many countries now is happening in the household, at family level. In some senses, transmission has been taken off the streets and pushed back into family units. Now we need to go and look in families to find those people who may be sick and remove them and isolate them in a safe and dignified manner.
Just so you know, we're coming to your house, seizing your children and, quote, isolating them in a safe and dignified manner.
You're not sure that America will ever get it together to do some of the more extreme forms of isolation and intrusive monitoring.
This is just the beginning. This is just an attempt to freeze everything in place. Then the real work begins. You've got to get people who are infected out of their homes so that they don't infect their family members. Even if they have mild cases, even if they have almost no symptoms, they're going to have to go someplace where they can get over it together. We need to test literally millions of people because the first time you get a negative test means nothing. A negative test yields no information. Sometimes it takes 3 or 4 days, even after you have symptoms, for a test to turn up positive. A lot more to do even after we go into a lockdown.
What we would do with people who had fevers. What you've described as these sort of temporary hospitals where people who have mild or moderate illness have to leave their families. People who have fevers and get diagnosed as even just mild cases need to be isolated outside of their home.
Is it safe to walk into a grocery store while openly carrying a fever? You're endangering the other people in the store. Now we're going to put you in isolation. We're going to, you're for your own protection. Not everybody's case is mild.